This video is being made to go over equipment use and being familiar with your equipment. In order to be efficient within an emergency, you need to know your equipment well. The first item we are going to address is CPR, release button. And on every bed in the acute care setting, you will see this CPR release. And what it is when somebody is sitting up in the bed and the bed is not completely flat, it is a very quick way to lower the bed quickly. Making sure that your knees are bent. A heavier patient will cause some back issues if you are not prepared for it. Make the button underneath squeezes towards you, and then the bed will come down. The second item is that you want to be familiar with your side rails. There's various side rails in the hospital settings with the different beds. This bed, for instance, has a release button here, and the side rail goes up in 2 stages. You want to push, go around. The inner buttons are for raising the head, raising the foot. Just be familiar with each button or each bed and what the buttons are on the bed. Make sure that your brake is on, and making sure that your headboard, you know how your headboard comes off. Underneath, you will see the 2 sections there that line up with the 2 poles at the headboard. You want to ensure that the headboard is off when you are using the bagger so that you maintain a proper seal. The patient in acute care will always have a headboard with oxygen and suction, and in some of the older institutions, medical air will be present. Make sure that your flow meters, you know how to insert your flow meters. They will be found in the emergency respiratory box. Oxygen is always labeled green, so green to green. Medical air, black. And your suction canister, or your suction unit is attaches to the yellow. In order to attach these flow meters to the wall, you push and take the big dial at the back and turn it very firmly until you do not hear any more hissing. And have it secure. An adapter is needed in order to put on oxygen tubing for nasal prongs or mask, and sometimes this is referred to as a Christmas tree. Setting up your suction system, you want to ensure that you have tubing that goes from the wall unit to your actual canister that attaches to the white spot underneath. This suction canister goes onto the wall, and you will see in the clean utility room, you will have a suction liner as well as the lid. The lid has 3 openings: a vacuum, a patient, and a site for the gel to solidify secretions. The lid snaps onto the liner and then is inserted into the suction unit. Ensure that the vacuum hose is attached to the vacuum outlet, and you will have connecting tubing that attaches to the patient outlet. Sometimes you'll see what's called a little elbow that attaches onto that top piece for the patient, and the connecting tubing can go onto that. The other thing is that the connecting tubing can also be placed right over top. When you are taking the suction liner to the biohazard, make sure that this elbow is off before you place the cap on. Onto our suction tubing is a Yonker suction, and the Yonker suction is set up for oral secretions in the time of emergency or for possible gastric aspiration of the patient. Sometimes some units will have a setup at the bedside with the packaging just to ensure that this these pieces of equipment have not been used on anybody else, but they are brand new. I mean, sometimes they'll just sit them up like this. Just check with your unit protocol to see if what the protocol is for each patient, and at the beginning of each shift, this should be part of your safety check. In order to bag your patient properly, ensure that the pillow is out from underneath their head and also that the headboard is gone. You need to position yourself up near the head of the bed. The bagger is in the respiratory equipment bin and will attach to a face mask at the upper end. The oxygen tubing attaches to the bagger at this end, and then to the Christmas tree or oxygen flow adapter. Ensure that the bagger or the oxygen flow meter is up to at least 15 liters per minute in order to inflate the bag properly to give 100% oxygen to your patient. Once the code team or advanced care team arrives and a intubation is done or the ET tube is in place, ensure that you know how that the bagger attaches to the ET tube. The contents of the emergency respiratory bin will differ from unit to unit. Make sure that you are familiar with the unit's respiratory bin. It will be with the emergency equipment. Inside, there should be a bagger, a face mask, oxygen tubing to attach to the wall, the bagger to the wall, connecting tubing, a Yonker section, and oral airways. The endotracheal tube may be placed by any medical professional that is certified in intubation.